You have an L4, L5 disc bulge or herniation causing sciatica or leg pain that just does not seem to go away. Well, what a lot of people are not telling you is that most rehab routines just focus on flexibility or temporary relief, and they really don't deal with total core stability or core stabilization or strengthening. So in this video, I'm going to walk you through 3 standing exercises designed to, typically, we want to rebuild the strength, we want you to rebuild the stability in your spine so you feel safer, you're stronger, and you finally start having long-term recovery. There's no equipment involved. And the beautiful thing is that you can do them standing, and that's the best part. So it's pretty convenient to do several times a day. These are proven exercises that I've used with many patients and I've used myself. So stick around to the end because I'm going to show you exactly how to fit these into your day and how small tweaks, I'm going to modify them a little bit, can make a big difference in healing. I'm Dr. Gregory Kramer. I have over 33 years of clinical experience and certifications in chiropractic biophysics. I specialize in treating chronic spinal problems like chronic L4, L5, disc bulge and disc herniations, chronic and acute whiplash, chronic neuropathy, chronic knee problems, chronic foot problems. Basically, as I get older, I take care of more older people and deal with more chronic problems. I use a variety of methods. And many of these methods, I not only learn from seeing over a couple 100,000 patients, but also I learn from working on myself. So we use CBP protocol, which is mirror image, adjustments, exercise traction. We use non-surgical spinal decompression to decompress discs, joints, and nerves. We use targeted rehab exercises, not only to help improve your posture, but also to make you stable. And that means we want you to be able to apply loads to your spine, everyday activities, without any pain, all right? So we use a variety of these methods, all designed to get your body pain-free, stable. And that's really the big thing. So before I continue with this video, you know what you gotta do. Do me a favor, hit that subscribe button, like it and share it to anyone you know that's having back pains, any of your coworkers, sports fans, or family members. And so that you all can basically eliminate pain, stabilize your body. That means do stuff without problems. Avoid surgery. Nobody wants surgery. And at the end of the day, we all want to live stronger, longer. We all want to extend that health span. Now, we're going to stick with 3 key exercises that you can do standing. One is called the Founder, and you might have seen it on the internet, and it was presented by Dr. Goodman. I always like to give credit where credit's due. I'm going to modify it a little bit, but I love the simplicity and beauty of this exercise. It takes into a lot of very common core principles that I like to use. The other exercise is we're going to be squatting, and I constantly talk about squatting. And then the second thing I'm going to do is we're going to talk about standing thoracic rotation. And so we're going to move through the video. I'm going to show you exactly what to do. I'm going to show you how you can modify it. You can make it harder or you can make it easier. And then I'm going to show you how to fit it into your day. This is one of my favorite, if not the favorite exercise for spinal stability. It's called the Founder. All right? I'm going to show it from the front, then I'll show it from the side. The first thing we do is our feet are shoulder width, our knees are just a little bit bent, and our shins are vertical. The second thing we do is we're going to bend at the hip, just like we've shown you in the past with how to lift or a hip hinge. The third is where our thumbs are out and we're going to squeeze. So our chest is out. Okay? Now, big chest, your weight's on your heels, your thumbs out, your shoulders are not up, but they're down and back. From this position, if you're not, that's N-O-T, not in acute pain, you can make it a little harder by raising your arms up as high as you can. You're going to hold 10 seconds. All right? Really pushing your hips back. Getting the weight on your heels, arms up high as you can. And to avoid hyperextending your lower back, avoiding too much, you're going to tighten your stomach muscles. You should feel no pain, no pinching in the lower back, but you should feel the muscles turn on. So once you're up as high as you can, tighten your stomach. From there, you're going to reach out. Push the hips back. You're not going to bend forward like touching your toes, but you're going to reach forward. You're really pushing your hips back. From there, you're going to bring your arms back, chest out. push on your knees, and stand up. That would be 1 repetition. Now, if you're in acute pain, do not bend too far forward. 0 pain, maybe only a little bit, and don't raise your arms up. Maybe just this for now. Nothing should hurt you. Now, from the side, again, we're not squatting. Okay, the knees are not going forward. Just a little bit of a knee bend. Hips go way back. We're hinging. Thumbs out. Squeeze those shoulder blades. Chest out. Don't hyperextend. You should feel the muscles turn on in the lower back. Like something kicking in, but not pinching, not grinding. If you feel pinch or grind, tighten your stomach a little bit. That usually takes the pressure off. If you're not in acute pain, you can make it a little harder. Reach up high as you can. Hold 10 seconds. Push your hips back. You can play with this a little bit. You can go up and down a little bit if you want. Now from here, push the hips back even more. Feel a great stretch. From here, put your hands on your knees, chest up. You're bracing. Chest out, stand up. That's 1 repetition. That's the founder. So again, if you're in acute pain, you're not going to raise your arms up all the way. Maybe you'll go partial. The beauty of this exercise, I recommend working up to 60 seconds 3 times a day. I do it all the time. If you're going on a long drive, throw the founder in. You've been sitting too long, throw the founder in. Okay? That's a great exercise. If you want to make it easier, or a little bit different, is that you can do a version of this when you sit. So if you can't get off your chair and you need a 30-second break, same thing. Chest out, arms at back, reach. Pretend you're lengthening your spine. You're going forward, big chest, shoulders down and back, thumbs out, squeezing those shoulder blades. And if you can, at your desk, raise up, reach, and you can find a sweet spot and do about 10 reps, chest out, bring your arms back, and sit back. And then you could also push forward, reaching. Think about lengthening that spine, and then when you come up, chest out, you're bracing, push up, okay? Now, what I like to do after I do the founder, we do a seated thoracic or a standing thoracic twist. This is great. This is just like gym class. Again, we bend forward, chest out, we reach. Now, hands down, hold 10 seconds, switch sides. Hips back, hands on knees, chest out, bracing, come up. You notice we brace every time we come up, and we put our hands on our knees to make it easier. Can we modify that one and do that sitting? Sure we can. Remember, nothing should hurt you. Chest out, we're reaching forward. Now from here, one arm down, go as far as you can. The motions can be a little bit limited. Notice when we're doing the thoracic twist, my arm is 90 degrees. You'll have a tendency to do this as opposed to this. It stretches the shoulder, stretches your pec. The most common postural misalignments we see is shoulders roll in. So the beauty of the thoracic rotation, it opens up your chest. It's great for your shoulders. It's great before golf. So if you did the squat, the thoracic rotation, the founder, you spend 2 minutes before and after golf, how good would you play? Before and after working out, before and after wrestling or jiu-jitsu, before and after going on a long drive. You see how simple it is? If you could do it a minute, a couple times a day, before and after you chase your kids. And then the last one is just squatting deep. Knees out, chest out, or upright. Now, if you can't go all the way down, we've shown you in the past, you can sit on a chair, you can hold on to something. So again, Knees out, chest upright. Push your knees out with your elbows if you like. Hold each rep 10 seconds. Squatting, thoracic rotation, and the founder. Now you have 3 powerful back and core stability exercises. You can do it at home, you can do it at work, you can do on a trip, you can do it anywhere because you don't have to get on the ground. These are all designed to eliminate pain, protect your spine, teach you how to lift, avoid re-injury, but you really want to do is build lasting strength and stability so you can do all the things you want to do. Now, let me ask you this. We showed 3 of them. We showed the founder, we showed the squat, and we showed the standing thoracic rotation where you twist. Which one of those did you like the best? Now, I personally like them all, and they're even, and I constantly, throughout the day, I do them all 3 because they're so simple. It's like a flow. Now, the founder is great for the lower back, the mid back, the upper back. It's great for your posture, and it's also great for your shoulders, for shoulder stability. The thoracic rotation, obviously, is for the thoracic spine, but it really helps the lower back. The better your thoracic spine works, there's less pressure, less tension. It kind of spares your lower back. And the squat, again, the better your hips work, we're going back to it, it spares the lower back. So one of those you'll probably like best. Let me know. I'm always curious to see. And also, did you like the modification? I showed you an easier version. If you can't stand up, you can kind of modify it and do it while you're sitting. Now, bottom line, if you like this video, you guys know what to do. You've been around. Like it, share it, subscribe so that we can help other people grow this channel and so that you can eliminate pain, stabilize your spine, avoid surgery so you can live stronger longer. Now remember, subscribe if you want to learn. Eliminate pain, avoid surgery, stabilize your spine so you can live stronger longer. The next video you guys should watch is to learn how to heal an L4, L5 or an L5, S1 disc herniation without surgery. Go watch this next video next.